I joined the Nationwide Children's Hospital in 2003. Over the years, I learned pain and anxiety are big challenges during pediatric medical care, such as brain dressing changes, emergency department IV injection, laser treatment, orthopedic treatment. Given the current crisis, opioid crisis in the United States, people have explored different non-pharmaceutical ways to empower the patient to manage their pain and anxiety. I asked myself what I can do to help them. I found out virtual reality may be the answer. Using games to manage pain and anxiety is not new. 2,000 years ago, the Chinese classical book, Romance of Three Kingdoms, described major surgeries. Before the surgery, the doctors asked Guan Yu, the general said, "Are you sure you can do it? Are you sure? This will be very painful." General Guan Yu said, "Go ahead, and I will play chess with my friends." Back then, there's no opioid pain medications. And the surgery went very well. People are still amazed by how playing a game can help the individual manage their pain and anxiety. Back to our world now, virtual reality game has become part of our life, particularly among those children 6 to 17 years old. And people are amazed how playing a game can help them manage their pain, and they ask, what's the scientific foundation of that? Actually, in 1965, scientists proposed an attention gate control system. According to this system, our attention channels can only handle certain amount of pain signals. If we can distract people's attention from the painful medical procedures, the individual will feel less pain and less anxiety. During the past 70 years, technology revolution has made the small, powerful virtual reality a reality for us to implement that at the clinical settings. We are lucky to have nationwide children's hospital game developers here. I worked with them to develop this virtual reality game. Is that a fun game? Okay, you will ask, does it work? Yes. I designed a study, randomized 96 to 17 years old during their brain dressing changes into 3 groups. In the active group, they play the game. In the passive group, they just watch the exactly same content without any interactions. We compared their self-reported pain with the standard care group. We found out not only our virtual reality games are very effective in reduce their pain, and the effective side reach the clinical meaningful point. And then the families and the patient love it so much. And we wondered about what the neural mechanism behind this. According to the hypothesis, our brain have certain pain processing regions, those marked red purple, blue, and green. And we all know certain cognitive behavior treatment can affect certain regions, those marked by parallel lines, and help the patient to manage the pain. Now, scientists propose virtual reality can add pain management effect by affect those regions marked by black dots. Actually, scientists test that theory by recruiting healthy volunteers and put them into the functional MRI. They designed a study and assigned those volunteers into 4 groups. On the left side, you can see no VR, no pain medication. On the right side, VR plus pain medication. In the middle, either no opioid pain medication or no VR. Functional MRI signals can tell us, well, which region is active. Those marked red means the brain region is very active and you will feel pain. But those marked by green means the area is calm, less activity, you will feel less pain and anxieties. Based on that functional MRI slides, you can say virtual reality plus pain medication can affect all those 5 pain processing regions to help the individual to manage their pain and anxieties. We have implemented studies among patients who received brain dressing changes, emergency department IV injection, orthopedics. In our ongoing studies, we are testing this among those children who receive laser treatment. 3 weeks ago, I was sitting in the preparation room trying to prepare for the study. A girl in the treatment room, she was crying, screaming, and said to Dad, "Dad, this is painful, I cannot do it, I cannot do it." That lasted for several minutes, and doctor finally gave up and said, "We cannot do it, you need to come back." In fact, this is her second visit. In the first visit, she used our virtual reality, everything went very well. You can say our virtual reality is so powerful, and nurses love it. They create that scoreboard and put that in the treatment room. I truly believe this is a powerful digital technologies will empower our care providers, nurses, and physicians, but also help the patient to manage their pain and anxieties. I encourage you to join us in our adventure by spreading the words about our innovative technology so millions of children across the United States and around the globe can benefit from these cool technologies. Thank you.